Welcome to Euroband's unique approach to the treatment of pre- and post-hemodialysis. This revolutionary set for on-off procedures has been developed by Euroband's R&D department in cooperation with the Department of Nephrology of the Golda Meir Medical Center at Asharon Hospital, affiliated with the Sackler School of Medicine at the Tel Aviv University in Israel. Contamination between patient and appendix increases the risk of hepatitis C, hepatitis B, and HIV. When reusable and non-disposable equipment is used, the fear and ever-present dangers of cross-infection exist. Misplacement of used items increase these risks. The best solution is a separate sterile methodical procedural set containing systematic placement of components for easy accessibility. A pair of latex gloves. Absorbent, non-permeable sterile seal to be placed under the patient's arm. Absorbent gauze sponges for disinfecting. 2 newly designed adhesive U-shaped tapes. The U-shaped adhesive tape is elastic. Adhesive is applied in vertical lines to facilitate easy removal. The tape is horizontally elastic and non-elastic in the needle direction. The tape is highly porous for ventilation. 4 adhesive strips for securing the tubing strips have elastic properties. Components for post-dialysis are a new pair of latex gloves, 2 sealed Diapress hemostatic adhesive bandages, which are slightly elastic in both directions. Here too, adhesive has been applied in vertical lines to facilitate easy removal. A non-adhesive film has been applied to the surface of the island gel foam pad, which expands on contact with blood and is highly absorbent. The gel foam ensures a completely dry wound surface. The Diapress is air permeable but water repellent and withstands washing. After removal, the skin underneath is dry. 2 T-shaped plastic disposable pressure armlets prevent blood spurts. The block on the armlet fits directly over the absorbent sponge on the Diapress adhesive bandage. Armlets have a release clip for pressure adjustment. Method of use. The sterile film pack is opened. The sterile film is spread under the arm. All components are ready for use. To avoid pressure on the blood vessel, the U-plaster is placed over the butterfly with the U-shape positioned over the blood vessel into which the needle is inserted. Adhesive strips secure the tubing. The remaining components are set aside for the second stage of post-dialysis procedure. A new pair of gloves are used. Strips and U-plaster are easily and painlessly removed. The Diapress is applied over the point of needle penetration and adheres around that point. The pressure armlet is placed over the diaphragm sponge. Digital pressure is exerted and the needle is removed. Pressure is adjusted. The patient's pulse must be checked. The second armlet is immediately used. There is no need for concern. Experience shows that although the tape adheres to the butterfly, the needle is always easily removed. The two shake facilitates the free flow of blood. Following the necessary waiting period for that particular patient, the armlet is removed by releasing the release clip. Note the blood-free surfaces. The patient is free to go on his way. All components, used or unused, are discarded. In cases where a longer pressure armlet is required, for example for use on the patient's thigh, two armlets can be joined with T-blocks facing inwards to form one strap. In this case, the unused T-block will later serve for the removal of the second needle. Old versus new. The old system of adhering the needle is passé and has been replaced by the U-flap. The use of sponges and time-consuming digital pressure has been replaced by the pressure armlet, which also ensures steady, even pressure, keeping the shunt or graft intact. The old system, where pressure was not steady, resulted in causing clots in the shunt or graft. Our new system keeps the blood vessels free of clots and prolongs their use. Let's review the main features of Euroband's new dialysis set. Prevents contamination and cross-infection. It allows for systematic use of all indispensable components. It saves valuable time during needle insertion and removal procedures. The set is cost-effective, both where components and labor are concerned. The steady, even pressure exerted by the armlet ensures that the shunt or graft remain clot-free, thus prolonging their durability. All Euroband products are manufactured according to GMP regulations and are FDA approved. Thank you for your attention. For further information, please call your local distributor. Details are printed on your video cassette. Thank you.